Welcome, everyone. It is Thursday, October 29th. You can see already we have a stellar lineup for you. I wanted to just call your attention to the slide up on the screen right now, the virtual media lab. We'll be putting something here into the chat for you all to see, but just wanted to call your attention to it. It is 12 to 1 on Monday, and all the information is here, and we will put this in the chat and circulate it. I wanted to just say a couple of points before I turn it over to Alan to introduce our phenomenal speakers today. We recognize this is a tremendously stressful time, as Alan discussed last week in his introduction, or sorry, earlier this week. It's all blending together now, that we know this is the run-in to probably one of the most critical elections of our time. Simultaneously, we have case numbers surging in the US. They may be surging where you are. We know that cases have reached alarming new records right now. And so depending on where you live, it may be hitting you directly in your communities, particularly areas in the Midwest and in the West have really seen an astronomical rise in the rates of COVID right now. And we just want to let you know that we and your TFs are here for you. We want you to feel free to reach out to us at any point. Obviously, Alan and I have office hours twice a week, but we can always happily set up other times to meet with you outside of that. So we just wanted to open with that and let you know we're here for you. I think a second point I just wanted to make is the context of this conversation today, because I think it's a really critical moment to step back and look at global governance. And I wanted to kind of just go back in time for a few minutes to think about where we were in January, February, March, when this was exploding. And yet the conversations were happening in a somewhat fragmented way. Certainly some nations were deep in this, others were still coming to terms with it, including our own nation. And I went back to confirm it was March 11th that the WHO declared coronavirus outbreak to be a global pandemic. And at that time, I actually wanted to look and see, it was 114 countries at that point had reported 118,000 people had contracted COVID-19. And at that time, nearly 4,300 people had died, which seemed astronomical and deeply concerning, certainly to anyone who was paying attention or in the field of public health. And I think it's important to look back at that as we're in this moment right now, where the numbers are going through the roof. Even yesterday alone, there were 1,000 new cases just in the United States alone. And I think the quote I had from Director General Tedros describing the situation as a pandemic does not change WHO's assessment of the threat posed by this coronavirus. It doesn't change what WHO is doing, and it doesn't change what countries should do. So I leave with a question, or I'm leading with a question, which is, as this pandemic unfolds, what is the role for a global body like the WHO in this conversation? Because as we know, viruses do not respect borders. So with that, I will hand it over to Alan to introduce our tremendous speakers today.
Thanks, Ingrid. As I've told everyone in the class, I wake up every morning and I look at the data that's on the front of my digital edition of the New York Times. And yesterday, over 10,000 new cases detected in the United States, over 1,000 deaths. And I watch that number very closely. And as I've mentioned to you, I watch the hospitalizations especially closely, because that's a sign of how many people are really sick and need to be hospitalized. And that number's going up. And it makes it clear that this is not an issue of more testing or recognizing that many people have the COVID virus, but rather that many people are sick and many people are at risk of death. And I was thinking about that in light of today's session, because one of the things that Ingrid and I said very early in the course is one way of regarding a massive global pandemic like this is that it's a stress test, much like we stress test banks and financial institutions. And the epidemic is clearly stressing our global health infrastructure, our principal strategies and mechanisms for national and global security. And so today we have 3 participant observers, analysts in that domain. And so I really want to get to our speakers. They're people who have had extensive experience in the public sector, the private sector, academic life. And all 3 of them have thought deeply about the problem of pandemics and pandemic response. So our first speaker today will be Juliette Kayyem. And I have to say, as somebody who's either glued to my screen reading media or glued to my television screen watching CNN, I feel like I get to see her. I feel like I get to see her a lot. It's wonderful to have her on my screen this morning. And she is one of the most thoughtful, analytic, and influential thinkers in the wider domain of security. She worked extensively after doing a law degree at Harvard Law School in the Deval Patrick administration, centering attention on homeland security issues in Massachusetts. She later went to the Obama administration, where she had fundamental responsibilities in terms of homeland preparedness for major environmental disasters, as well as for pandemics. She has worked in the private sector, and she has a major role at the Kennedy School, where she's faculty chair of Security and Global Health Project. She just came from teaching at the Kennedy School. And it's really great to welcome you here. There's really not much daylight between the fundamental issues of global governance and security. During the COVID epidemic, she's been advising state governments, mayors, public health practitioners about the response to the pandemic. So it's great to have her here. Our second speaker will be Suerie Moon, who several years ago left the Harvard School of Public Health and the Kennedy School, where she was active, to become co-director of the Global Health Center at the Graduate Institute of International and Development Studies in Geneva. We were just talking before we got on the call with all of you. Dr. Moon is in Geneva, where the surge is intense and governments are considering strategies for locking down again. And I have to say, Dr. Moon's been one of the most important theorists of global governance, global health systems, and how we might think about the problem of epidemics in a world of nation states and sovereign nations. And so I'm very eager to hear her perspective. She worked extensively following the Ebola epidemic on issues of preparedness and resiliency. So it's wonderful to have you here as well. Our third speaker will be Dr. Jim Kim, who is really a remarkable leader, again, has crossed all sectors from academic to private sector, but is especially well known for the time he spent at WHO, where he started a major project to bring antiretrovirals to low and middle income countries at a time when many people, many leaders said, it's just not possible. And Dr. Kim has always been challenged by the idea of saying, well, we can't do this. And I think you'll hear from him today that he'll say, we can do this and here's how to do it. And that's been one of the inspiring things about his leadership, not only at WHO, he was also the president of Dartmouth and then went to the World Bank Group, where he was the president of the World Bank. So his extensive experience in this area, I guess I should say, I've known Dr. Kim since he was a first-year medical student at Harvard Medical School, when he and Paul Farmer and Ophelia Dahl hatched the idea of partners in health. And it's a remarkable thing, but it's a reminder to all of our students that people who are in school can do so much and actually create sustainable institutions for social justice and human betterment. I don't know if Dr. Kim will mind, but he had a very impressive reputation among his fellow medical students, and everyone would come in. These were the old days when people still took tests on paper and come in and socially distance during their exams. And Dr. Kim was famous because there would be 2 and 3 hour exams in the medical school, but he was always the first one to leave. And at first, this may have been a source of consternation to his fellow students, but they really began to appreciate this. And so Dr. Kim would come in, take his exam. It was probably a 3 hour exam. He would leave after 45 minutes, and everybody would stop and cheer for him as he made his exit from the exams. I know this is a true story.
Yeah, so I ran out of answers is why I left.
In any event, this is really, this is the group that if I could get in one room for 1 hour, I would do it. So I turn now to Juliette Kayyem to open the session.
Oh, I'm so thrilled to be here, Alan and Ingrid. Thank you for having me. When you asked me a couple months ago, I guess you were that organized. Who would have thought that the data would be as Alan describes? There was a brief window here in the United States when maybe, just maybe, if we had, as I often say, just respected COVID and recognized that it only wants 2 things, right? It wants a new host and respect, and we are, I think, living the challenges of a lack of respect in some ways. And I want to make clear, I am not a doctor, nor do I play one on TV. I am what we call in our space. I'm a consumer of health intelligence. The brilliant doctors and others that you read about are providing information about the virus that people like me who are on the response side take to learn lessons. So things like voting on November 3rd, as Ingrid was saying. In March, I was crazy. I was like, we have to find all alternatives to in-person voting, blah, blah. Now we know more, right? So the goal is now is convince those people who we may have scared or who don't have the ability or not allowed to in some states vote by mail to come forward. If you go to, my statement now is if you go to a market, in other words, you don't have preconditions that are making you nervous, you can vote with masking and everything else. So I want to get to the subject here and apologize at the outset if it's a little US focused, only because I want you all to see how one nation's perception of this as a domestic threat is ultimately, I think, either going to have to be reset or thought through differently, and how this fits into sort of homeland security generally. I came running from the Kennedy School where I taught. It's raining here in Cambridge, and so my internet was funky this morning. If you lose me, I will call back right in. I just wanted to put that I had some challenges earlier this morning. So let me just tell you why this wasn't a surprise from the domestic front, and this should be true of most nations that were prepared. In terms of homeland security, which we view, which one should just define as sort of, how does a nation protect itself, right? The biggest threats tended to be, at least for the United States and most of Europe, and certainly Asia in many cases, were borderless threats. So that's the four borderless enemies. So it was climate change, right? So we're seeing that. In other words, that the solution had to be not had a domestic solution, but also has international. The rise of radicalization, which is being shared across networks, so to speak, in terms of the threat, cybersecurity, which you're going to hear a lot more about in the days to come, and pandemics. We knew that. I was part of the leadership team for H1N1. I cannot stand when I hear people say we were lucky. It's the challenge of people like me. It's called the Preparedness Paradox, which is the more a nation becomes prepared and can minimize the harm and is, screaming for people to take vaccines as we did in H1N1, then it's not as bad as we feared. And then everyone says, why the heck did they freak out, right? So that's like Y2K for those of you who know what that was, as well as potentially the election. If we get a decisive here in the US, if we get a decisive closing on November 3rd, or no path forward for one of the candidates, everyone will say everyone was freaking out, but actually it was because everyone freaked out, right? We protected networks, we got people to vote early. So the problem was I think, or one of the things to think about is a domestic challenge like pandemic has national security implications for every nation, and therefore requires the global response and the global cooperation that I think is lacking right now, at least from the US perspective. And the reasons are multiple, and I just want to go through some that may be not apparent, especially for many of you who think of national security as sort of state to state. And that was actually the challenge, as Alan was describing some of my work at the Kennedy School. The actual challenge I've had at the Kennedy School for years is we have a very, very rigorous national security faculty and programming. It's something called the Belfer Center for Science and International Affairs. We have former secretaries of defense, former leaders in the State Department, former heads of the CIA. Those were viewed as the key attributes of national security. So someone like me who comes and says, well, Homeland Security is part of national security, and pandemics, which is a key part of our response, are part of the national security. It took me 4 years to build both a national security program and a security and global health. It was just that the way that the academy and therefore policymakers were thinking about it was just not in the same realm as sort of weaponry or intelligence or even diplomacy. So the fact that we're not thinking about it that way, or we've now come to a new understanding, is not surprising to me. Now I don't need to convince anyone either that Homeland Security or that global health is part of the security platform. So I want you to think about ways in which it's impacting national security, which becomes part of the need for a global response. So one is clearly supply chain issues. So the challenge in the United States now, but for those of you who are calling in from Europe, you're seeing right now with France closing now through December, Germany with new protocols, is supply chain of limited resources. Do we have enough stuff? I often say, as Alan probably sees me on TV, this is not the rocket science part. This is, what do I have? What do I need? How do I move it? With a global demand, we are going to need some entity, WHO or whatever, to begin to assess where the resources are needed. You're going to have countries in competition. You're going to have continents like Africa maybe out of competition because they don't have the resources, and you don't want an entire continent not having one respirator per country or per million people. So you have a supply chain challenge with this, a global supply chain challenge. Secondly, in each country, you have a force protection challenge. I want you to think about this in terms of your national security, global security. This is real. Here in the United States, our entire Joint Chiefs, the people who lead our military, were quarantined for a week because of exposure. We don't have good numbers globally about what military assets have been harmed. We have challenges here in the Navy, as I know Britain does as well, just given the contact intensity on submarines and boats. That is for real when you think about a global security effort, because what happens is now my third point, which is COVID is the national security issue of our time, right? I mean, in other words, it cracks me up to have reporters ask me, are we so first of all, distracted by COVID is a joke, right? Are we so distracted by COVID that other important issues, national security issues, aren't being addressed globally, right? So, and I say there is no other national security issue for any country because we're on our knees, right? But also because our distraction, our focus on COVID is allowing bad actors to do other things. So you're seeing bad actors, sorry to be loaded on that, bad actors maybe from the perception of US, but China's aggression, Russia's aggression, Iran's aggression with our election. So just think about that in terms of why would we want a global unified responses, then everyone can focus on, you could, chew gum and rub your belly at the same time. The fourth is to think about national interests, right? As national security interests is our sense of, is a nation's sense of strength is also about perception. So those of you outside the United States now, what do you think of the United States right now? Those of you those of you in New Zealand, you're feeling pretty good, right? I mean, in other words, perception is part of a global security framework, right? In other words, and this is a real challenge when you put global health against our more traditional security interests. So from the US perspective, once again, I don't want to be US focused, but just think if you're a US policymaker, you are already seeing the rise of China. Okay, so we can only spend so much time blaming China for COVID, right? Okay, now I'm looking at their economy, I'm looking at their response, I'm looking at their Q3, blow it out of the ballpark economic strength. And if you're a third country and you're thinking, where am I going to focus, right? Where is Europe going to focus? Where's Latin America going to focus? So this is also why, in a different way than you may think about it, this is a security issue for each of our nations. So so what are we going to learn out of this? So one is just quickly in terms of is surveillance was key. And transparency was key. That takes a global effort to minimize the security threat for each of ours. Is whatever, I'm sure you spent a lot of time on what China did and didn't do. I am telling you this now. I first tweeted, and I do not have access to intel anymore. A non-expert, I'm an expert on response. I first tweeted about COVID January 2nd. Right. So this was not a shot. In other words, the first Wall Street Journal article, people knew. So we need greater transparency, greater communication about what's going on in the world to prepare other nations. That can only come through a global apparatus, right? And carrots and sticks against nations that refuse to be transparent. Second, on a global supply chain, we need to have resources available. We need to know who's manufacturing what. Is it viable? Is it good? Look, we do have standards for this stuff. No one can just make it. And you need some sort of market or oversight, as we will see, I think, in the months to come, to control the market around this, around what we anticipate. And then third, finally, the United States decided to go alone on the vaccine. Essentially, if you follow me, I am a vaccine skeptic only because that's what you pay me to be. In other words, I don't do hope, I do today, right? And so my worry is our focus on vaccines and all the great smart scientists and all the people who are making gazillions of dollars is keeping us from, I kind of do have a vaccine now. It's called social distancing and masking, right? I want to focus on today because I don't know when the science, and then don't forget manufacturing and distribution which add months and months. That's my space, is how do you move stuff from point A to point B, is going to take a global effort. And it's really unfortunate that we're not part of that. All of this can get fixed. There might be what might be called a course correction or a more embracement, but that's sort of, for me, why, both from a totally self-absorbed US perspective, but you can be self-absorbed in your own countries as well. This is clearly having an impact on our national security, but also why a global response is needed for a threat like this, because we're kind of all in it together. So I hope I didn't go over, but I'm going to take questions at the end.
That's great. I can't help but think, as I listen to you, that our president became infected and many White House staff our vice president was exposed and intensely by the Joint Chiefs had to quarantine.
Yeah.
And it has been curious to me that with all the things you're talking about, that there wasn't a bubble put around our political leadership, and that, you know, our security notion would really include the White House as opposed to a White House that was really open to the infection.
Right.
And that usually we think about protecting leadership as a crucial
Continuity of government. It's the, you know, from the nuclear days, continuity of operations, continuity of government. A rational response would have been, we essentially would have hidden Mike Pence from the beginning of this, right? But that's not the way this White House did it. You just need a number two to be healthy. And we just didn't do that, right? And that, I'll tell you one aside is, you know, I hear from the intelligence community when Trump got sick, you know, that was a, you know, what his condition was of grave concern to both our allies and interest to our enemies in the intelligence community. So you have another thing of which they're sort of, you know, surveying us about.
This is really fascinating. We'll get back to it. Thanks so much.
Thanks.
Now I want to introduce Dr. Moon, who will talk more broadly about some of the global governance issues that have already come up.
Oh, that would help. You would think after 1 billion Zoom calls. Amazing how often that still happens. So I was just saying, I think my comments will follow on very nicely from really where, Juliette, where you ended your comments, which is on the importance of global cooperation. And partly what I'm going to do is talk about what kinds of arrangements do we actually have at the international level to make this kind of cooperation and information sharing happen. And as a spoiler alert, I'll just say, you know, we don't have what we need. We don't have much, actually. So what I want to do is focus a little bit on what we do have, and also I think on a perhaps slightly more optimistic note, talk about some of the reforms that were made within the last 5 years that put us in a better place as of January of this year than we would have been otherwise. Doesn't mean we were ready, certainly, but we would have been worse off in some ways. So I want to look at some of the changes that were put in place in response to the West African Ebola crisis back in 2014. Let me just say before I dive in that it's a real honor and pleasure to be here. It's great to be back at Harvard, even if just virtually for the next hour with all of you. And what a pleasure to be with so many big brains, including, of course, those on this side of the panel and all of you who are taking this as students. So what I want to highlight is that the World Health Organization has had its ups and downs in its 70+ year history. And the West African Ebola crisis, which many of you will probably remember quite clearly because it wasn't that long ago, was, I would say, a real low point. Until 2020, I think it was a real low point for WHO. And there were a lot of efforts to try to assess, okay, what went wrong, both within WHO, but also in terms of the global system more broadly. And one of the things that did happen was a heavy emphasis after the crisis on strengthening national capacities, national action. And of course, this made sense because the West African crisis hit 3 of the poorest countries in the world, Liberia, Sierra Leone, and Guinea. And the region was also emerging from years and years of civil war. So this was really a region where you had not only deep poverty, but a real fraying of the social fabric, weak public health systems. And so the problem of preparedness was very much framed as national weaknesses and as a development issue, and that we had to address this through humanitarian aid, through international cooperation, and through development assistance. And so one of the reforms that was put in place, I would say, is what was called a peer review system to ensure that all countries were making adequate progress towards having some kind of national, strong national health systems in place. You know, obviously we can look back and conclude that whatever changes were put in place certainly were not adequate. So this was an important change. There was some discussion also what I call the global safety net. So what can WHO do to support countries? What can the World Bank do to support countries? And Jim will remember this very well, as well as other international actors. How do we support some of the weakest links in the chain as we were thinking about things back then. And of course, we see today that the weakest links are not necessarily those that we thought were the weakest links just a few years ago. Where I think there actually was much less understanding, much less emphasis, much less action was here in this outer circle. So what are the things that need to be put in place inherently at the transnational level in order to, in fact, make sure that as a global community, we are in fact prepared for an outbreak. So what I want to do is to have you engage in a very brief thought experiment with me and think about what are some of these inherently global or transnational functions that have to be carried out, because of course, no single country, not even a country that's a superpower, can actually do this by itself. And so if you imagine that all 200 plus countries in the world actually have super robust, highly capable, fully supplied national capacities to prevent, detect, and respond to outbreaks, what still has to happen? That means there's no need for a global safety net. What still has to happen at the global level? And what we did in some of our analysis following the Ebola crisis was in fact try to articulate and specify what these were, and we put them broadly under 3 categories. And I should say that I have 8 minutes to present this to you today. If you want to go into this in more detail, your deputy teaching fellow, Liana Wushki, worked very closely with me and a broader team on this. So please ask her for more enlightenment. But if you look at these 3 buckets that I've put up on the screen, you can see there's a whole set of issues around the international health regulations. That's the main treaty that was put in place decades ago to try to structure international cooperation. So a lot of emphasis, for example, on trade and travel restrictions, on emergency declarations, and information sharing. That makes a lot of sense. Still lots of work to be done there. But there's this whole set of issues in the middle on research and information sharing. So it's not just basic information about do you have an outbreak or not. But I think the single most valuable thing in the earliest days of an outbreak of a novel pathogen is information. Everybody wants to know what exactly is this pathogen, what kind of disease does it cause, how is it transmitted, who's susceptible. And of course, we don't know that in the first days of an outbreak. So we do rely very, very heavily on the country that's hit first to share that information, and on scientists to share information as quickly as possible. We also have, of course, big challenges now getting access to drugs, vaccines, diagnostics, countermeasures worldwide. And this is, I think, one of the areas that we didn't pay enough attention to. Then in this last bucket, we have the global institutions that have been created, in fact, to help countries come together, work together, and address some of these other challenges. Of course, WHO, the UN system more broadly. What I want to highlight is that there were weaknesses across all of these areas, and there were also a number of changes put in place. And I'm not going to go through these in detail. There's lots of reports that have been written. But just to say that WHO did undergo very significant reforms at a programmatic level, at an institutional level, both at a programmatic and institutional level. But there were still, in fact, many, many questions that remain unanswered and many weaknesses that remained unaddressed as of January of this year. And in fact, these are still in place. And you can see it has to do with financing. It has to do with how does WHO deal with member states that are both its clients and its bosses, as well as its funders in a way. And so what I would say, let me skip relatively quickly through all this, is that there are a number of priorities that have been put on the table in the first, I would say, 6 months or so of this pandemic. And there are a number of other priorities that we're going to have to deal with. And these are my take on what these are when we get to the post-crisis period. Already there are 3 major reviews underway, and these are the formal official government sponsored reviews of WHO and the international system. But a big open question with all of these reviews is there going to be enough political willingness by sovereign nation states, in fact, to give up a little bit of the control that they have, in fact, to be willing, in fact, to allow, for example, international teams or experts to come in the middle of an outbreak in order to build a more reliable system for cooperation and information sharing. And I think that's the billion or even $1 trillion question. At the end of the day, it doesn't come down to WHO. It comes down to what individual nation states decide to delegate WHO to do. Let me just wrap up my comments by leaving you with this idea, which is that generals are always preparing to fight the last war. And I think in the security community, they talk about this a lot, maybe not so much in the public health community, but this is certainly what we saw. When we think back about what happened post-Ebola, as I was saying at the beginning, all we did was talk about this as a development issue. And obviously, we look at where we are today, outbreaks are not a development issue only. And in fact, some of the countries in sub-Saharan Africa are doing far, far better at combating this this pathogen than in countries in the Americas and in Europe. And so this was a real blind spot, I think, was that we are not prepared, even in the most advanced countries, in industrialized and wealthy countries. And this is really not, we cannot afford to neglect this global level architecture. I think there are really four key areas at this point that need more attention, where there really were blind spots over the last few years. One is better managing the trade and travel issue, addressing the massive drop in public communication and trust that we've seen in the last decade, ensuring access to drugs, vaccines, and other countermeasures. Juliette was highlighting supply chains, absolutely still a problem, and very, very few arrangements at global level to actually deal with this. And then finally, financing, always a bit of the Achilles heel. Let me just close by saying, we know this is not the last outbreak, not the last pandemic. And after every single crisis, you have the same cyclical discussions. We have to invest, we have to prepare, we have to, reform the system. I hope after this crisis, we will not be only fighting the last war. And I hope that all of you as young people will be, in fact, helping us to think beyond the last war to make some of the changes we need at the international level. Over.
Thanks so much, Dr. Moon. I've had this one thought that I just want to try out on you very quickly, which is I've been very concerned about the sort of public notion that this is a once in 100-year pandemic. Because I think every time somebody says that, and I've heard many, very prominent commentators talk about that, rather than really talk about what we need to do to make things right and the investment that it will take, it sort of says, why would we invest when we have so many problems and we're recovering from this pandemic in the kinds of structures and thinking that you're really talking about? So it's kind of a linguistic language thing. But I think it does have importance that there's no reason to believe with COVID-19 that it'll be another 100 years before we have a pandemic that has very different properties, but is incredibly threatening. I don't know what you think, but.
I think that's absolutely right. And there's certainly evidence and as well as driving determinants that suggest we have already had more frequent outbreaks and pandemics. We think just in recent years about Zika, Ebola, the various flu, sometimes more outbreaks, sometimes at a broader scale than that. I think the deeper determinants of those outbreaks are continuing to barrel ahead. So absolutely, this is not, I'm not going to wait another 100 years before I think something like this would happen. I think what is still shocking to me is I hear people talking about never again. This is like the Second World War. This is this is a once in a lifetime kind of crisis. And yet when I hear about the proposals for reform, and they've started to circulate, certainly here in Geneva, they're timid. They really do not match the magnitude of the economic impact, the human impact, the health impact, the disruption. I mean, this outdoes any nuclear weapon that has ever been deployed. And yet the amount of attention, and this is really, I think, I'm in full agreement with Juliette on this, it's the attention given to pathogens as potential security risks is far, I mean, it's amazing. It's not just public attention and money, it's government willingness to say, we will put in place a regime that is as strong as possible in the same way that we've tried to do for the governance of nuclear weapons and nuclear proliferation, the same way that we've tried to do for other weapons of mass destruction. And here we have on our hands already the evidence that this is far more destructive, right? What we've seen in the last year. So I do wonder when 2 and 2 will come together. It's not happened yet here in my little town. But I think it has to happen soon.
one thing I've been thinking along those lines, and we can talk more about it in the Q&A, is that the way we conceive of preparedness has been quite narrow. And that if you built better health systems, if people had access to care, if you reduced health disparities, all of those things would be crucial elements of considering preparedness. And we know that healthy people do best in an assault like this. So I do think that the preparedness, sort of path has been perhaps too narrowly defined as we think about it. But this is a big issue for us to discuss. But thank you so much for your presentation. I want to turn now to Dr. Kim, and I told him that I would be happy to pose a few questions. Dr. Kim has so much experience in thinking about this, and even though he's gone to the private sector where he's emphasizing investment in infrastructure, he has been here at the center of discussions about what to do and how to think about this pandemic in real time. And I think one of the things he'll bring to the discussion is this idea that with lots of experience in terms of thinking about AIDS, in terms of thinking about SARS and Ebola and other threats, I want to start by asking, why do you think it has been so difficult to prepare infrastructures for an event so widely predicted in the scientific and public health sphere?
Thanks, Alan. And let me just also say, it's such a privilege to be in this class with one of my very first teachers. Alan was one of my very first professors and one of my students. Ingrid, she taught me more than I taught her, but was a student. So it means something. I'm not quite sure what, but it's a tremendous privilege, and also to be with Suerie and Juliette. You know what, Alan, what I'm going to do is, what Juliette and Suerie have presented are so rich. Let me just respond a little bit with some color and get at this question: why are we where we are? So,
right.
Juliette has certainly been, taking a little bit from Hamilton, which was then stolen by another dude. Juliette's been in the room where it happened. I've been in the room where multilateralism happened, where, I've been at every G20 leaders meeting, every G7 leaders meeting, and we've been sitting there, and often toward the end, I was one of the longest serving members of the G20 leaders meeting. And so I would introduce new leaders to each other. And so being there, I think the thing that I'm sorry to say, of course, I'm saying nothing to Juliette. She got to work for one of the greatest leaders, I think, in recent memory. But I think it's very hard to get our head around the idea that leadership matters so much more than we think. I mean, I've lived in this world, and Suerie has been the one who has defined what needs to happen in this world better than anybody. And we want to believe that a rules-based system and systems of accountability, we want to believe that this matters, but one leader can just blow everything out of the water. If one leader decides, I'm just not going to participate in the G20 anymore, it then stops being a way to solve problems. And I've had direct experience of why the G20 was so useful. It was at a time when Japan was going to reduce their interest rates. They were going to do things that scared everybody because they thought a currency war was starting. We went to the very cold Moscow, and we sat in that room, ministers of finance and central bank governors, and we decided no one's going to say currency war. No one's going to say these 5 words that could set off a panic. And it worked. So, everybody coming to the table and deciding what to do in order to protect the global economy. We walked out of there, everyone followed the rules, and it worked. Now, if one country had said, I don't want to play, I'm going to do whatever I'm going to do, that would not have worked. And so I guess the only thing that comes out of that is just to say, vote everybody, you got to vote, because the leadership matters far more than you think. And I don't want to name names, but Suerie will especially know, there were personalities that led to the Ebola response being what it was. And I got the World Bank involved in Ebola when it was like the last thing that we were supposed to do. We're not supposed to be involved at the time in outbreaks, but I started calling meetings. We pledged $400 million and got it through the board in 9 days, just because I was trying to bring appropriate attention to something that, I was shocked to find that the World Health Organization, much like the White House getting rid of the pandemic preparedness group that Juliette had helped to prepare, they had gotten rid of their epidemic response group. I just couldn't believe it. I said, where's Mike Ryan? The guy who has been involved in every Ebola outbreak from the very first one. And Mike had been he'd been fired, right? So these things matter far more than we think. And so the question is, can you put together systems that are more automatic, that just kick in and that we can all agree on ahead of time? Now that's one. The other thing is, I think that the global health, public health community has to do some hard and tough soul searching, right? How is it that in the richest country in the world, we succumbed to a defeatism, a nihilism so early in the epidemic? I just couldn't believe what I was hearing. Oh, it's too late to do contact tracing. And I was saying, what are you talking about? Even if you can't chase down the outbreaks now, you've got to build the capacity to do it so that when the cases come down at some point, we hope, then you start chasing the outbreaks down. What have we learned? Every single country that's been successful or more successful has done aggressive testing, contact tracing, and what we're calling supported isolation and quarantine. Not everyone has the economic means to isolate or quarantine, and you've got to provide that. Every single country that's been successful has done those things. And of course they have, because we've known since John Snow, who took the handle off the water pump and stopped a cholera outbreak, we've known that that is the fundamental that you have to engage in. And we gave up on it. We gave up on it quickly. I called Tony Fauci. Tony and I have worked on 5 different pandemics together. I called Tony and said, Tony, why are we only talking about social distancing? Shouldn't we also do all the other things? And he said, of course, Jim, of course we have to. But I'm just trying to get them to accept that there is a problem and that we should do something. We're just trying to protect the hospitals, but if you can do more, please do. So that's why we started the contact tracing program in Massachusetts. And we at first, we trained 2,000 people. And when the cases went down, we reduced that number. But guess what? Now, because these people have been trained, we're able to scale that up. And as far as I know, there aren't a lot of states in the United States that have that capacity. And part of it's because the public health community has been saying it's too late, right? Which is just nuts. And Alan, it's exactly what we were facing with MDR, TB, and HIV, right? Here we were sitting there, 25 million people in Africa living with HIV, most of them not knowing their status. And the entire global health community, literally the entire global health community said, sorry, it's just too complicated to treat, all those people in Africa. It's just too complicated. And we were going crazy because saying, if we let 25 million people die of HIV because we think it's too complicated, we will always be remembered as the generation that did that. Just like the Holocaust generation, we will be remembered as a generation that let Africans die because we thought it was just, too much of a hassle. And so that same process, I said to myself, that will never happen in the US, and it did. And, Juliette was part of some of the conversations. There were people on the Harvard faculty who were saying, the answer is herd immunity. What we should do is maybe go back and forth with a little bit of social distancing, but in the end, everyone will get infected. They'll have immunity. We'll have herd immunity. And I was saying, herd immunity, we're going to have herd culling, and we know exactly who's going to get culled. The differential mortality is very clear. We know who's going to get culled. We cannot sit back, but we fell into it, and we did it again. And so the public health community has to look itself in the mirror and say, why did we do that? Why did we give up? Tony didn't give up. Tony kept saying, we've got to do more, we've got to do more. I'm just trying to keep the any kind of response going. And I think he's been absolutely a hero in the midst of all of this. But my conversation with him is, Jim, of course we have to do all those things, but I'm just trying to get this started, right? So we went from defeatism and nihilism of the global health, public health community to this crazy magical thinking that took over everybody. And this goes right to what Juliette's saying, right? The notion that a vaccine will solve all problems is one of the most destructive ideas that we face. Because, you know, when people say, well, isn't the vaccine going to change things? I say, well, you know what? In China, the vaccine will get them back 100% to full economic activity. In New Zealand, in Australia, any place where they have got it under control and have the public systems in place, the vaccine will be remarkably effective, and it will really reduce any of the, get rid of any of the other breaks on the economy. But in the US, are you kidding me? Let's say we have a 70% effective vaccine and 50% get it. That's 35%. And now we know that the immunity that they have will probably not last for very long. And so you go back to the same issue. You need to do community-based, and what the Democrats in Congress have been calling it is testing, tracing, and supported isolation, which is great. There was $75 billion in the last $3 trillion bill. And I was just saying, we've spent $4 trillion and nothing on the one thing that's been proven to get this pandemic under control. And it's the public health response. There's nothing. And in fact, not only do we not still have money for this, but the White House has specifically rejected more financing for the public health response. So this magical thing, let me just tell you how it, I was calling all the business leaders that I knew well from my time at the World Bank. And I was saying, you guys, you understand, this is not a financial crisis. This is a public health crisis. And the only thing that's been proven is these steps, and we have to do that. And everyone would say, yeah, but you know, we're going to get a vaccine soon. I would say, you know, I've been fighting viral diseases for a long time, and there ain't no such thing as an immediate vaccine that gets 100% and everyone gets it. And boy, treatment of viral diseases has been incredibly difficult, you know, over the last decades. And yet they still went back to that. And here's how bad it was. I was on a webinar, and I said, we've got to do this, and we can't open up so quickly. This was back in April. And my friend, a business leader, well-known, said, you know, Jim, you public health people have no credibility anymore. Oprah Winfrey in 1987 said 20% of Americans would be infected with HIV. Didn't happen. We were in Los Angeles. We prepared the UCLA Medical Center for all these cases. Didn't happen. We're going to open up. It's already going to happen. You know, it's a choice between the economy and the pandemic, which is just, you know, incredibly widespread thinking, but it's just so wrong. It's just so wrong. So let me stop there, because we need to have some more discussion. But I have to say, you know, the global health community has to fess up here, right? The idea of herd immunity, guess what, was taken up by Jair Bolsonaro in Brazil. That's what he's saying. And the advisor of the White House now is talking about waiting for herd immunity, right? So the defeatism, the nihilism, and then the magical thinking, you know, has put us in a situation. This is one of the worst, infectious disease disasters that I've ever seen in this country today. You know, inability to communicate. I mean, we had problems in Liberia communicating to people to not touch the body at funerals, but we succeeded eventually. If we can't convince half the people in the United States to wear a mask, I don't know where we're going.
I have to say, this is very sobering, but it's things that we have studied and we do understand, so that makes it even more frustrating. Some of you may know, and some of the students may know, my first book was called No Magic Bullet. And it was really based on a premise that I learned from Dr. Kim and Dr. Farmer and others, that you could have the implements available, but you couldn't get them to people in a timely way. So we had curative treatments for syphilis and gonorrhea, but those diseases remained, you know, highly prevalent, despite the fact that we had the tools. And this has been an ongoing story, that the argument shouldn't be public health versus biomedicine, but a fundamental way of rethinking their integration so that we can have effective strategies that get us to and make accessible the technical aspects of biomedicine, treatments and vaccines. It's so interesting. We talked so much in the spring about flattening the curve, the idea that we had to reduce cases so as not to overwhelm our hospitals. But the real strategy had to be, how can we mitigate the epidemic until we can truly get to effective medical treatments and vaccines? And it turns out that the reality of that has been totally misrepresented, it seems to me.
Well,
That it's
you
going to
know,
be very hard, as all of our speakers have suggested, especially in a place like the United States, to successfully roll out a vaccine program where we distrust science. We start with a lot of hesitancy on the right about vaccines. And now we've added hesitancy in some ways among people who believe in science because of the politics of the development of this vaccine. Anyway, I really want to.
Just one quick comment.
Yeah,
you know, Tony didn't say the whole sentence because he couldn't, right? But the whole sentence is, because this is such a friggin' disaster, and because we're in such a terrible situation, the best we can hope for is to flatten the curve, right? And if we can flatten the curve, maybe we can prevent the kind of disaster that they saw in Northern Italy, right? But the whole sentence was, you know, if we could do it, if we're really serious about stopping this pandemic, we would have testing, tracing, support, isolation systems in place in every state. There would be national coordination. We would be working with every other country in the world, and the CDC, you know, that seconded 250 people to the smallpox eradication program. It was, and the CDC knew, Bill Foege, D.A. Henderson, always fly the WHO flag, but WHO doesn't have the technical capacity. It's the CDC that really supplies the workforce. You know, all those things had fallen apart. So in the situation where we're in such trouble, the best we can do is flattening the curve. But then it became, it became some sort of magic, you know, bullet that flattening the curve is all you need to do. And then even in Germany, where they were much more science-based, you know, Chancellor Merkel was saying, if we can just keep the R naught below 1, we're okay. That's actually not true. They need the R naught to go down much more radically, but at least they were thinking about keeping the R naught below 1, and they were trying to measure economic activity in that way. So there's still, you know, there are so many things that were not said that should have been said, that now it's hard to go back and say, well, that's actually not really what we meant. Flattening the curve was not the answer. It was just the best we could do in a difficult situation.
Let me turn this back to Ingrid, and we'll get some students in.
Well, it's hard to even begin to follow these three tremendous speakers here. And I think most importantly, we should turn it over to our students and get a few questions in. So, but I can't thank you three enough. It's really, I feel like I could just sit here for hours listening to you, because this is it. But let us bring in some questions from our students, because we have a lot.